Hello everyone, I am Dr. Swati Mehta and I want to share my knowledge about application of homeopathic medicines in case of obstetrics and gynecology disease conditions, and today my topic is abortion. Fertilization is a process for development of the embryo. The oocyte is penetrated by the sperm and then there is a development of the embryo in fallopian tube for at least 1 week. The abortion may be spontaneous or induced, is defined as the expulsion of products of conception before the embryo or fetus is viable, that is before the 28 weeks of gestation, and the product is having weight less than 500 grams. The type of abortion we can divide it into the spontaneous and induced. Induced means it's an aided. We have to do something or with the medication or by the criminal style. So we can divide again this induced abortion into legal and illegal, and the spontaneous abortion is divided into isolated and recurrent. Isolated, we can consider it is from the threatened abortion, it is missed abortion, incomplete abortion, complete abortion, septic abortion, and inevitable abortion. Well, recurrent abortion is known as the habitual abortion. The causes of abortion are important for us to find out certain medicines. There are different factors. First, we can consider fetal factor, where there is a defective embryologic development and there may be abnormal chromosomes, means congenital defect. There is faulty implantation of the fertilized ovum, or there is a failure of endometrium to accept the fertilized ovum. The placental factors are premature separation of the normally implanted placenta, or there is abnormal placental implantation. And the psychological factors, which we can consider the fear, the anxiety, the worry, the grief, the sorrow, etc. Maternal factors are also important in case of homeopathy, because from this we can find out the miasms. The first test we always advise patient for the habitual abortion, that is TORC test, that is toxoplasmosis, others like syphilis, gonorrhea, rubella, cytomegalovirus, herpes simplex, and HIV. It's also known that severe malnutrition or severe anemia are the causes of abortion, and in India, in the poor patients, these are the factors to develop abortion. Another cause, that is the incompetence of the cervix, means cervix is not properly remains closed, and up to some extent, up to you can say 2 or 3 or 4 months after that, the cervix starts dilating and cervix cannot able to control itself, and that is known as incompetent of the cervix. Endocrine disorders like thyroid dysfunction, or you can say PCOS, or we can say diabetes mellitus, hypertension, autoimmune disease, are the causative factors for abortion as a maternal cause. Any trauma or injury at the pelvic organs, or there is phospholipids antibodies disorder, or there is blood group incompatibility, that means the person, the husband is having positive blood group and the wife is having negative blood group, and if the baby is of positive blood group, chances of abortion is 100%. And the bad habits like smoking and alcohol are the cause for abortion. Threatened abortion is the only that type of abortion where we can survive the fetus, because in this abortion the fetus is alive. When patients comes to us, there is a vaginal bleeding, and with that patient is having low abdominal pain, or you can say dull aching pain. When we examine the patient per vaginally, the os is closed. If you don't want to examine per vagina, we can advise patient to go for sonography, and in sonography we can find out the cardiac activity of the fetus is present. That means the baby is alive and we can survive the fetus, and we can complete this fetus to the fully matured baby. And this is the abortion where homeopathy can works very nicely. Inevitable abortion, the name itself suggests that you cannot stop this abortion. And when patients comes to us, patient may not have pain in abdomen, but patient will ask us that there is something is coming through the vagina, or there is a slight vaginal bleeding or slight lower abdominal pain. When we examine the patient per vaginally, there is a partial dilatation of the cervix, and all the things vitals of the baby are present, but the baby cannot remain in the womb and the baby has to be aborted by itself. In this case, sepia is a medicine in homeopathy which I had used many times to prevent inevitable abortion at 7th month, and I got the best result from this. Incomplete abortion, that means some of the parts come out from the uterus and some of the parts remains in. So when we examine the patient, when patient comes to us with the bleeding, we can find out that something is coming through the cervix by per speculum examination, and the blood which is partly clotted and partly fluid, and this is the indication of sabina, where expulsion of the remaining products of conception without any surgical aid we can use to remove the remaining parts of the fetus. Complete abortion means the placental portion and the fetal portion, or you can say complete products of conception, came out from the uterus. And when patients comes to us, the size of uterus is just like a normal uterus and the os is totally closed. Patient may have slight bleeding or there may not be any bleeding, but there is a history of pregnancy and something come out from the womb at home. Missed abortion, that means there is a growth of embryo up to some months, and then after the growth is retarded, or you can say the fetus is dead inside, and the period of amenorrhea continues. So when patients comes to us, there is a history of amenorrhea, but the size of uterus is less than the period of amenorrhea, and by sonography we can find out that the uterus, in the uterus there is embryo which is dead, cardiac activity is not present, and sometimes patient comes with the discharge which is brownish in color. Main management of threatened abortion is important because here we can survive the fetus. So we have to keep the patient in complete bed rest, and we have to stop the bleeding with help of some anti-hemorrhagic medicines. We have to give certain medicines which will maintain the pregnancy. In allopathy they are giving hormones, in homeopathy there are lots of medicines. From amongst all these medicines we can find out the symptom similarity and we can give it to the patient. Intercourse must be forbidden and any heavy work must be forbidden for that female till the pregnancy is survived. In case of inevitable abortion, most of the time the doctor has to assist this abortion and to come out the fetus and help the fetus to come out with certain aids. But in homeopathy we can give sepia with the head low position and frequency of the sepia every 2 hours or every 1 hour, and we can prevent the further dilatation of the cervix, and we can survive the fetus and continuation of the pregnancy. So the patient can have a full-term delivery. Incomplete abortion, we have to refer the patient to the gynecologist for the dilatation and evacuation of the uterus. So the products which is remain inside the uterus will come out and there is no further blood loss to the patient. With homeopathic medicines like Cicalcor and Sabina or Cantharis, we can do the products of conception come out by itself with the help of medication, and we can prevent the surgery on the patient. Missed abortion, we know that the fetus is already dead inside, so fetus must come out from the womb, and products of conception completely come out from the womb. So we have to refer the patient to gynecologist for DNE, or we can give Cicalcor so that the products of conception come out by itself with the help of a medicine. Recurrent abortion means more than 2 abortions history, and here there are many causes like paternal and maternal chromosomal dysfunction or disharmony, and patient may have diabetes mellitus or autoimmune disease or thyroid dysfunction, or we can find out the TORC, infectious disease. So here we have to use nosodes. So if patient is having diabetes mellitus, we can consider it as a psychotic miasm, and we have to find out certain drugs to prevent this abortion, which is having antipsychotic measures. If patient is having autoimmune disease, or you can say there is a thyroid dysfunction, or patient is having gonorrhea, syphilis, or patient is having HIV, then we can consider it is a syphilitic miasm, and we have to give certain medicines which will cover the syphilitic miasm and can prevent the disease, abortion. Legal, that is therapeutic abortion, and that is done by the gynecologist, that is dilatation and evacuation, where there is a health of the mother or life of the mother is disturbed. At that time the induced for the medical reasons, and that is dilatation and evacuation, where patient is having chronic hypertension or malignancy, severe heart disease, or there is failure of conception, or the pregnancy is because of the rape. These are the process of induced abortion which is legal, and I'm not going to describe it much because we are thinking about the homeopathic medicine. These are the instruments important for the students of gynecology, third BHMS, that the plastic cannula is known as Carmen's cannula, and the another that is the suction machine. And most of the time this Carmen's cannula, the groove portion will scrap the endometrium or the products of conception, and with the help of suction machine it is suctioned into the machine, and all the products of conception is taken out by scrapping all the 4 walls, anterior and posterior and the lateral walls. These are the dilators, Hagas dilator for the dilatation of the cervix. This process is conducted by the gynecologist and not by the homeopath. Amniocentesis, or you can say the taken of the amniotic fluid, and here the examination to find out that there is a chromosomal abnormality or there or not, and it is also used for the abortion, but not by the homeopath. It is done by the gynecologist. When there is a failure of any induced abortion after the completion of 12 weeks up to 20 weeks, then the gynecologist will perform hysterotomy, that is the C-section of the uterus, and take out the baby from that. And again it is not for a homeopath. These are the advantages and disadvantages of the medical abortions, and the question will be asked during exams of the third BHMS. You have to learn it. That's it. Therapeutics means the application of medicine and the disease condition. Aconite is used for the threatened abortion at third month. All of us are knowing that there are the psychological causes of abortion, and aconite is a medicine where patient is having fear, fright, or there is severe anger leads to abortion. In India, the young girls has got pregnancy at the age of 20, 21, who do not know what is pregnancy and what happens during labor. So she had a fear when she had pregnancy. So these are the symptoms which I have discussed in this slide. You have to match these symptoms with the history of anger or fear and threatened abortion at third month. Means pregnancy is there and the fetus is alive. You can use this medicine to prevent abortion. Gelsemium, the causative factor is lack of muscular coordination. We all know that there is upper uterine segment and lower uterine segment is having rhythmic contraction and relaxation, but sometimes maybe because of psychological cause or because of endocrinal cause, the rhythm is disturbed and that leads to abortion. We can use this medicine to prevent the threatened abortion. Also, fear factor is important in gelsemium because gelsemium patients are always depressed and she has a fear to go in crowd, and all the symptoms you know better about gelsemium. We have to match it with the patient's symptoms, and if it is applicable, you can use gelsemium for the preventing abortion. Sabina, we already discussed in case of incomplete abortion, that abortion at the third month or during third month, and there is discharge which is coming out from the cervix or from the vagina, which is the blood is partly clotted and partly fluid. With that, patient is having severe pain in the small of the back and it is going around the our abdomen goes down to the thighs, that is exit labor pain, and patient comes with that. You can use Sabina to remove the products of conception without any aid of the surgery. It is also used for the retained placenta after delivery where there is development of the atonicity of the uterus, and in case of removing the hydatidiform mole, we can use Sabina, so it expels out the mole and there is no need of any surgical aid. I already told that sickle core is used for the threatened abortion at third month, that is missed abortion, because the discharge is black liquid blood and there is prolonged bearing down pain. There is difficulty in contraction of the uterus and there is a foul smelling discharge which is coming out from the cervix, from the vagina, and she feels that everything is loose and open but there is no expulsive action, and patient is severely chilly but does not want to cover. That is the specific symptoms for sickle core. You can use when you find out that patient is having missed abortion and patient does not want to undergo surgery, you can use sickle core to remove the products of conception. Sepia, I can say the miracle of homeopathy, because many of the patients I use this sepia at 5th or 7th month where patient is having inevitable abortion or patient is having threatened type of abortion where os is closed and fetus is alive. I use sepia to prolong the pregnancy, continuation of the pregnancy, and I got the best result of sepia. You can find out the symptoms which are present in sepia are matching with or not, but you can use sepia when patient is having inevitable abortion at 7th month or patient is having threatened abortion at 5th month. I already told you that severe anemia is one of the causes of abortion, and elytris farinosa is a medicine for that. Habitual tendency to abortion means patient is severely anemic. So wherever patient is having pregnancy, because of the anemia, patient develops abortion because the fetal circulation is attached with the maternal circulation and fetus nourishment is from the mother. So if mother is having anemia, the fetus cannot get proper food or nourishment, and that leads to abortion. Plumbum mat is a medicine where there is abnormality in the development of the uterus. I already told previously that one of the causes are Barr-Conway uterus, or you can say fibromyoma, or there is a septed uterus. And here you can find out in plumbum mat that there is a tendency to abortion from non-development of the uterus. And another thing is the fetus grows, but the muscular fibers of the uterus do not develop in proportion, and hence the uterus is no longer able to accommodate the growing fetus, and abortion ensues. So when you find out such patient before pregnancy, 2 or 3 months, you have to give plumbum mat so that there is a development of proper muscles, muscular fibers, and then if patient is having pregnancy, you can prevent the abortion. Pyrogenum is a medicine for septic abortion because when patients comes to us, patient may have a criminal type of abortion or patient have complete type of abortion history, but patient did not undergone any medication. So in that case, after 3 or 4 days, there is development of strepto or staphylococcus infection, and that leads to septic condition. So when patients comes to us, patient may be conscious, may not be conscious, but patient is in toxic condition where you can find out that is very uh, soft, or you can say quick pulse. Temperature is 103 to 106 degree Fahrenheit and the pulse is 140 to 170. The sweating of the body is cold, and when you examine the tongue, which is large, flabby and clean, smooth as if varnished, and it is fiery red. With that, if patient is having vomiting, then there is persistent brownish coffee ground vomiting. And if you can see per speculation, or you can find out the vagina, the discharge which is coming out is very, very offensive. If you can find out the filthy smell when patient enter in your room, and which is horribly offensive, you cannot sustain with that. Cantharis is also used for septic type of abortion where there is development of the urinary tract infection after abortion. Patient may have fetus product or hydatidiform mole inside the womb, and with that patient is having constant urging to urinate, and there is a bleeding or the blood mixed with the urine is present. There may be history of retained placenta and puerperal metritis with inflammation of the bladder, and in that case we can use Cantharis. This erigeron again we can use for the habitual abortion where the woman's womb is very weak and bloody discharge on the slightest exertion. There is profuse bright red blood and diarrhea and dysuria with abortion. The blood is gushing type, and the lochia, that means the discharge after the products of conception removed, is also comes in gushish. Crocus sativa we can use for the abortion at the 3rd month. It may be a septic or it may be a missed abortion, and we can find the discharge of blood which is partly bright, partly composed of black strings. And when we do post speculum examination, we can find out some uh, clots are coming from the cervix, and patient is having bounding feeling, and patient is having spasmodic contraction and twitching of the single set of muscles. Viburnum opulus generally I consider that maybe because of the chromosomal abnormality or there is a developmental fetal abnormality leads to abortion, because this is the medicine for frequent and very early miscarriage. So the pregnancy is aborted by 6 weeks or 8 weeks, and there is say that ovum is expelled at every menstrual period, means it leads to abortion. It is for that, it is also used for the infertility. And there is a history of membranous dysmenorrhea, or there is a congestive dysmenorrhea to the patient, and with that there is a history of fainting on attempt to sit up during menstruation. We can use viburnum opulus. I am thankful to you for watching my video and gathering the knowledge about the application of homeopathy to abortion. And if you like this video, you can like and share with the others. Thank you.